Okay, very good morning to all. Thank you very much for giving me the opportunity to share this new technique and new technology in the field of neurosurgery, which is for the first time we have introduced in Gujarat. So it is called functional neuromodulation surgery, the art and craft of taming the nervous system. So we all know that the nervous system is not under our control as such, but there is a technology which is available now by which we can to some extent control the nervous system the way we want. So what exactly is neuromodulation? The history of neuromodulation, although we have started using this technology recently, the roots of this technique or technology lies way back in 15 AD. There is a documented evidence which suggests that people used to use torpedo fish to give electric currents to patients or those who are suffering from pain for the treatment of pain in that time. So actually the roots are there in 15 AD. From there actually the neuromodulation, the concept of neuromodulation started. So the definition of functional neurosurgery is very big, but just to summarize and just to give crux of that thing is, it is the technology, it is the technical advancement or the neurosurgical advancement which is used to relieve the variety of symptoms related to neurological disorders. And how it is done? It is done by using ablation, stimulation, modulation or transplantation. By any of the means, this technology is used to change the function of the nervous system. And the aim of this technique is to improve the quality of life. So the first of all, the first such technique or technology which we use is deep brain stimulation. So we all know there is, everybody will be knowing this cardiac pacemaker. So similarly, this is, in simple terms, it is a brain pacemaker. So what we do is, you can see in this image that two electrodes are placed deep inside the brain and they are connected with the wires over the chest with a battery, and from that battery electrical impulses are transmitted to specific areas of the brain. This is how this technique works. For each and every disease, each and every condition, the targets where we deliver the current is different. So the history of deep brain stimulation actually started in 1980s, where Professor DeLong and Professor Cosman, both of them were neurologists and neurosurgeon. They were working together. Along with them, their student was Professor Tipu Aziz. They actually found out that in a study of monkey, they found out that subthalamic nucleus, STN is subthalamic nucleus, it is overactive in patients with Parkinson's disease. That is what they, for the first time they found it. So initially people used to ablate and damage the subthalamic nucleus to relieve the symptoms. But later on, Professor Benabid on right lower side, he found out that when we stimulate that area with high frequency current, then it acts as inhibitor. It acts as a lesioning of subthalamic nucleus. So actually we anatomically we need not to damage or ablate the area, but we can stimulate it and we can get the desired effect. So this is Professor Tipu Aziz, who was one of the pioneers in development of this technology. I was fortunate enough that I had a chance to work with him in Oxford University, and I was trained under him. So as I already explained, what is deep brain stimulation? It is the brain pacemaker surgery. Electrodes are placed, they are connected with the battery. Battery is called IPG. It is implantable pulse generator. So high frequency stimulation is done in different areas of the brain, like nucleus of thalamus, subthalamic nucleus, globus pallidus interna, and ultimately it acts as neuromodulator and it changes the way the brain circuitry is functioning and we get the desired effect. So what are the indications of deep brain stimulation surgery? At present, US FDA approved indications are Parkinson's disease, essential tremors, dystonia, intractable epilepsy, major depression, OCD. These are the US FDA approved condition. But apart from that, there are so many other indications which are being explored and people are getting significant amount of benefit. So in future probably there will be so many other indications where we'll be using deep brain stimulation surgery. So in Parkinson's disease, when should we do deep brain stimulation? So as we all know, Parkinson's is basically a medical disease to start with. So initially levodopa is the main drug which is being used, and pharmacotherapy is the treatment of choice in initial phase. But Later on, the problems start occurring where there is wearing off effect of drugs, so effect will not last for longer duration. So because of that, there will be significant amount of fluctuations in the symptoms of patients. Apart from that, patient will develop dyskinesia, abnormal jerky movements, and motor fluctuations. And tremors, many a times in Parkinson's disease, they are not amenable to, or they are not responding to medications in many of the cases. These are the indications in Parkinson's disease where DBS is required. And usually, after start of the first symptom of Parkinson's disease, after around 4 to 5 years, these all problems start. And that is when we have to think about doing deep brain stimulation. So I have already told the other indications. So these are some of the patients. I have taken some of the patients whom we have operated already. We have started this program in Gujarat for the first time. We are the only team in Gujarat who are doing this surgery in Gujarat. So this is one of the patients who had Parkinson's disease. This is pre-operative and this is post-operative. So you can compare. On the left side, before surgery, patient was not able to walk at all, even with support. On the other side, pre-operatively, post-operatively, you can see the patient is walking absolutely normally after surgery. And before surgery, she was barely able to move her feet. This is what it makes the difference. This is another patient we have recently operated. This is the difficulty in walking before surgery, and this is after surgery. So this is what is the significant amount of difference deep brain stimulation surgery makes. This is one of the testimonials of our patient whom we have operated in this thing.
Last 5 વર્ષથી પાર્કિન્સન માં બહુ પીડાતા હતા અને છેલ્લા 3 વર્ષથી આ બહુ સફર કરતા હતા. તક સ્ટર્લિંગ હોસ્પિટલમાં DBS ને રિગાર્ડિંગ બધું નોલેજ મળ્યું, એ આખી ટ્રીટમેન્ટ કરી અને અત્યારે મારા મમ્મીને બહુ સારા સ્ટેજ છે. Dystonia હોસ્પિટલનો તો હું ખૂબ ખૂબ આભાર માનું છું કે જે મને બધી ફેસિલિટી બોમ્બે, બેંગ્લોર, ચેન્નઈ, દિલ્હી, જ્યાં મારે ન્યા જવાનું મને બધા ડોક્ટર કહેતા હતા, ઈ જ વસ્તુ મને ગુજરાતમાં અમદાવાદ સિટીમાં સ્ટર્લિંગ હોસ્પિટલમાં મળી ગઈ.
બહુ એટલે અતિશય આમ ઊભુવાય નહીં, બેસાય નહીં, ઊભું ન રહેવાય, હલાય ચલાય નહીં, એટલી તકલીફ પડી હતી મને. અને હવે આ ઓપરેશન કરાવ્યા પછી તો બહુ સારું છે, ઘણું સારું છે.
So this is the patient of dystonia which we operate. Dystonia is uncommon disease. Very few number of patients are getting operated all over the world. We are fortunate enough that we were able to make difference in this guy. Actually, he is a 28-year-old male. He started having the problem with writing in right hand. He was not able to write. So gradually the problem increased. He had to leave his college because he was not able to write. And gradually that disease progressed to involve the right upper limb as well as left upper limb, and trunk also was involved, including the neck. So he was not able to change his clothes. He was not able to eat or drink. After this surgery, he started writing after 14 years, and he is able to do all the activities by himself. This is the pre-operative condition. He was not able to straighten his hand because of the dystonia. And this is after surgery.
મને ડિસ્ટોનિયાની બીમારી 20 વર્ષથી હતી. પહેલાં જમણા હાથથી શરૂ થયું અને પછી બંને હાથમાં ધીમે ધીમે વધતું ગયું. કોઈ પણ કામ પણ મારાથી થઈ શકતું નહોતું અને હું લખી પણ નહોતો શકતો અને પાણી પણ નહોતો પી શકતો, કપડાં બી સરખા પહેરી શકતો નહોતો. આ માટે અમે બહુ બધી જગ્યાએ દવા લીધી, એનાથી અમને કોઈ રાહત ના થઈ. અંતે DBS સર્જરીની સલાહ આપી અને અમે આ પ્રોસિજર સ્ટર્લિંગ હોસ્પિટલમાં ડૉક્ટર ચિરાગભાઈ સોલંકીની નીચે કરાવી, દેખરેખમાં કરાવી અને અમને સારી એવી સફળતા મળી છે. પાણી પણ પી શકું છું, બધું કામ પણ જાતે કરી શકું છું, કપડાં પણ પહેરી શકું છું અને લખી પણ શકું છું.
So this is what it makes the difference. So this is one of the modalities of functional neuromodulation surgery. What are the other things we do in functional neuromodulation surgery? We have seen deep brain stimulation. This is spinal cord stimulation. This is basically a spinal cord pacemaker. The indications for these are so many, but most common, one of the common indications is pain. Intractable pain which is not getting controlled with medications. Apart from that, paraplegia related to spinal cord injury, many of the peripheral vascular disorders, all those things can be managed with spinal cord stimulation. So this is similar modality, but it is in the spinal cord. Another thing is intrathecal drug delivery pump. So many of you would have probably seen or doing this procedure, or you probably would have seen some of the patients also. So basically for two indications, one is spasticity, which is not controlled with medications. We put a pump, drug pump, which has baclofen in it, and it gradually releases baclofen inside the spinal cord directly. And so by that it reduces the spasticity with 1,000 times less dose of baclofen which we give orally. This is how it is beneficial, and significant amount of benefit is there for the patients in this technique. Apart from this, same technique is used for pain also. Morphine is used in place of baclofen. The pump is same, the drug is different. So this is one of the patients we have operated for spasticity. This is pre-operatively, he was not able to stand even before surgery. Hereditary spastic paralysis was the indication. In this condition, since childhood, this guy was suffering from this disease. He was not able to walk without support. You can see the legs, the distance between two legs is very less. They are so spastic that he is not able to stand or walk without support. The same thing, this is immediately next post-operative day. After starting baclofen injection, this is the improvement this patient has got. The significant now it is even better than this condition. So this patient, after this many years, he has started walking without support. So this is what the difference it makes. Apart from that, another thing is dorsal root ganglion. It is just a modification of spinal cord stimulation surgery. In this technology, in this technique, in place of spinal cord, the dorsal part, back side of the spinal cord, we put the electrodes in the dorsal root ganglion, in the root, in the canal. This is what is the main difference between spinal cord stimulation and dorsal root ganglion stimulation. Otherwise, technique is same. Similarly, peripheral nerve stimulation. You must be knowing vagus nerve stimulation we are doing for epilepsy surgeries. Phrenic nerve stimulation we are doing when patient has diaphragm paralysis and we are not able to wean him off the ventilator. In this situation, if you do the phrenic nerve stimulation, the diaphragm start working and patient can be taken off the ventilator. Occipital nerve stimulation for migraine and other headache syndromes. Supraorbital supratrochlear nerve stimulation for pain syndromes. Sacral nerve neuromodulation for bladder and bowel dysfunctions and chronic pelvic pain syndromes. And functional electrical pain stimulation in case of paralyzed limbs. These all are the modalities which come under the field of functional neuromodulation surgery. So functional neuromodulation surgery, if we talk about it, is basically a true team effort. Without team, you cannot do that. And I can say proudly that we are the only team of Gujarat who is doing, we have introduced this new technology in Gujarat, and we are successfully running this program for last 2 years. Thank you very much. Thank you.
Thank you, Chirag bhai.
Thank you.